everyone, and welcome to the third episode of the McGill Medical and Dental Student Podcast. I'm Maya, a second-year medical student.
And I am Jad, a second year dental student at McGill, and we are pleased and excited to introduce Dr. Joanne Liu as our guest for today's episode.
Dr. Liu is a pediatric emergency medicine physician. She was the president of Médecins Sans Frontières, MSF, for 6 years from 2013 to 2019. In 2015, Time magazine included Dr. Liu on its annual list of the world's 100 most influential people. In 2020, Dr. Liu was the only Canadian named in the Independent Panel for Pandemic Preparedness and Response, IPPR, to evaluate how the World Health Organization and countries handle the COVID-19 pandemic. So, Dr. Liu, thank you so much for joining us today.
Thank you to have me.
Thank you. Just to start off, so we wanted to know, why did you decide to go into medicine?
So I decided to go into medicine because when I was a teenager and I was going into this quest for meaning in life, I read different books. And one of the books I read was on a physician who worked for Doctors Without Borders, Médecins Sans Frontières. And he was working in war zones. And I thought, this is really cool. I didn't know back then that I had to go to med school, which is a bit brutal. But it stayed with me. And then when I did my first assignment with Canadian Crossroad in Africa, I told myself, I was 18 years old, this is what I'm going to do. I'm going to get medical training and go and work overseas. And after that, every single choices I made in school was to make sure that I would have basically a profession that would be exportable and would make a difference overseas.
Well, so you basically decided to go to medical school to join MSF.
Absolutely, yes.
Wow. Okay.
As a second question for you, what led you to choose pediatric emergency medicine as a specialty? And if it wasn't for pediatric emergency medicine, what specialty would you have done?
So I decided to go into pediatrics because when I was looking at the demography in what we used to call back then developing countries, and today we will call them low and middle income countries, was the fact that children were about 50% of the population. And I thought that it would be, fantastic to be working with children. I shouldn't run out of patience. And the reality is, when I did my peds rotation, I just thought that they were the best patient. Pediatric patients are literally the best patient. As soon as they do better, they start to play, they start to eat, and they have the best chances to recover from most of the diseases. So by far, I would still go into pediatrics. The kids they're the best.
If let's say if you wouldn't go into pediatric and you had to start over, is there a certain specialty that, like, another specialty you would consider?
Well, I know that I was debating for surgery back then. It's probably something that I would still sort of wonder about. Yeah, I guess surgery.
Surgery, okay. And then, did you have any in your training or when you were practicing medicine in your career, did you have a particular patient that really impacted you?
Difficult to say. Like, when I was reading the question, I was like, oh my God, what I'm going to answer. But I think it's probably the first patient I followed as a clerk student. And the reason why is I was working at a chest hospital, and it was a patient with lung cancer. And basically, he had decided I don't think this will happen anymore today, but basically, he was in palliative care, and he was at the chest hospital. And I was the only medical person who was coming and seeing this patient on a daily basis. And I just remember the weight of responsibility I felt back then, and how much that patient taught me um, about empathy, about respect for life, about dignity, and I'm so grateful for that patient. And at the end of the day, I think that it was as important to me that it was important to him that we see each other on a daily basis. And I always been grateful for my lesson from that is that every patient is teaching you something, and I'm very grateful to that patient.
And is there like a mentor that's impacted you, whether, it was in your career or in your studies along, the way?
Was a pretty much self-driven person when I was a student, and back then international um, career was there, but was still sort of um, not a career path that people will look for, which I think now, 40 years afterwards, is a lot of people saying, "Oh, I'm going to go in global health, or I'm going to sort of get involved in this kind of challenges." Back then, that wasn't really the case. But so my role model were more like those sort of iconic people, like Gandhi or Mandela. I was a huge fan of Mandela for some reason, because it was when I was training, we were right into the apartheid, and it was really, really present. So I was part of those students group, and then and very, very early on, it was such a I was so moved by their fight, uh, that I remember doing that very symbolic gesture of stopping to eat Granny Smith apples because they were coming from South Africa. That was like my way of protesting.
Okay. And then how do you foster your own wellness and resilience throughout, whether it's you're working in the ER with the kids, or when you were abroad, how do you cope with um the hard challenges of the job basically?
Well, I think that yeah, I was reflecting on this question, and I think for me, what is always been the driving force is when I do something that brings meaning, like deep meaning. And for me, and then for other people, it's going to be something else. For some people, it would be to have children and raise them and make them like global citizen of this world. But but my drive and what allow me to keep going is the fact that my interpretation of what I do is contributing to something that is meaningful.
Ever considered going into a political role, let's say in public health or something like that?
It's not really going into a political role per se, but I think that um, in 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 much more broader terms, um, what I do believe is the fact that if you want to change things, you need to take responsibilities, and then sometimes taking responsibilities means having a role of leadership. And that role of leadership can be political or non-political, bipartisan, or whatever, or you want to label it. But it's about taking leadership for me.
Okay, perfect. And then we're gonna switch on to talk about, Médecins Sans Frontières, which it has impacted your life so much, and you were the president for two mandates. So what was the biggest challenge in your role as president for MSF?
I think there were several challenges when I was the international president of Médecins Sans Frontières. But I think that what's stay with me in terms of challenge was when there were the airstrike on our trauma center on October 3rd, 2015, and where 42 people lost their life. And 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 why was it so tough? It was tough because there was so much anger across the movement. We were so upset. Um, and and for me, it was important to basically rally the movement, rally all the MSFer in basically transforming this tragedy in something a little bit more positive. And so this is why I push for having a resolution on protection of the medical mission in war zones, which was presented at the United Security Council on the 3rd of May 2016. And that was voted unanimously by the UN Security Council, plus uh, about 80 countries who back up the resolution. So that was a huge challenge because we basically started from a posture of being under attack to a posture of saying, let's ask the world to reiterate that there are rules of war. Uh, and so that was a tough moment, and it was good. Even tougher is the fact that even if we passed that resolution, it didn't change anything in the field, and we still got as attacked as before. And so that's tough because once you've rallied people and you believe momentarily that this could improve the situation at ground zero, and the reality after all the lead work, actually not much has changed.
I saw your speech at the UN. I think the attack you're referring to was Kunduz in Afghanistan. Um, how do you go about with your organization? How do you talk to the people and try, like you said, you wanted to make it something positive and you passed the bill and everything. How do you talk to to the whole organization and convince them, not convince them, but try to like bring positivity and bring them some type of um I don't, maybe closure, or like try to get them to move on from the situation to give them a sense of improvement. How do you talk to them on a personal level?
It's you have the choice, to just say, um, you you've been attacked and then you suffered, and you can stay in this kind of posture and just whine in a corner and be angry, or you can decide to just say, okay, what can we do, or try to attempt to do to improve the situation. So we thought that this was the path, and so it was to convince people to just say, I thought it was more detrimental for the organization to stay in an anger mode and an upset mode, and I thought that trying to transform that was a better way forward.
Yeah, no, for sure.
How do organizations such as MSF complement the role of existing government leaders in the fight against the pandemic? So, since the management of the pandemic is largely dependent on decision of the government leaders, like what's the place, or rather the role left for organization like MSF?
So this has been quite a challenge for this pandemic because of how we've been grounded, all of us. We couldn't travel for the big first part
Right.
of the response. And but what was interesting is and I wasn't the president anymore when COVID-19 started, but is the fact that the organization found a role in terms of crisis management and supporting as well a treatment center with circuit of patient, of hot zone, cold zone, warm zone, which is for us, when you work in epidemic like Ebola or cholera, you do that, with blindfolded. We're so used to that. And we thought it was quite funny because here everybody made like such a huge deal about having the different path of hot and warm and cold zone. And you know what? We do that so regularly in many circumstances when we tackle epidemics. So there was a bit of a role there, and in especially in MSF end up working in many high income country in Europe because they didn't know how to get started about those different zones, especially in long-term care facilities. They didn't have as many public health people assigned to those facilities, and so MSF end up finding a role. I think that for the coming year, MSF in a sort of ad hoc way, but probably more frequently, they probably will be involved in the rolling out of vaccination in different LMIC. We didn't see that much supply coming through in 2021, but the forecast for 2022 is um, a an increase in volume of supply of vaccine, and there might be some sort of contribution that the organization can do in terms of allowing and then strengthening the distribution of vaccine from parts to people's arms.
Perfect.
Okay, I didn't even know that MSF actually was helping, countries to, determine the zones and everything. I didn't know that.
Well,
Um
people didn't know how to do that. Like when it's one thing when you send, this is what we saw, I remember very well in 2020. People was receiving a note from the government to say, okay, so now you have to split and cohort your patient between the positive and the negative, and then you need to make path for the positive and the negative, and this should not crisscross, as well as your taker, your carer of those people. And this is not something we used to, but this is something we do all the time in, for example, in cholera epidemic or in Ebola epidemic.
All right.
Yeah, it makes total sense. Yeah, for sure. So yeah, I had actually a question about when you're on the field, when you're on, you were working for MSF, and you go abroad and you're in the field, and let's say like it's a war zone, it's a conflict zone, and it potentially might be dangerous even though you're supposed to be protected. Do you call your loved ones and your family to let them know, listen, I am in a conflict zone, we might get attacked, it's happened in the past. How do you cope emotionally with, I know you're there to help and you're there to be a physician and to try to help the team and everyone, but how do you cope emotionally while being in a serious conflict zone?
Right. I think it's personal for everybody, but for me, I don't call. Um, I think that I don't think it's helpful for my loved one, for my partner, except to get him so worried and not being able to do anything for me. So I've I've been a white liar. Everything is fine. The weather is fantastic. Don't worry,
Okay.
because I don't want to impose them to be worried about my situation, to a point that I remember once when I was coming from DRC, Democratic Republic of Congo, that back then we don't have, it was in the 90s, we don't have that many, the bandwidth was not as present, so we couldn't send email. We had to use um, um, uh, a special phone for that in the field and all that. So anyhow, I remember I was just connected satellite phone. I was just connecting like once a week, and but then we got under attack, and I couldn't for a while. And then at one point, when I finally got out of that hot zone, which was several weeks afterwards, I was looking at my email, and my partners just said, it'd be really great to get some news from you, because
Yeah.
from what, according to the BBC, things are not going very well. So that'd be good to get news from you. So I just figured out maybe I have waited a bit too long, but otherwise I tend to not do it.
Okay. Okay. Yeah. I understand. Yeah.
Switch gears a little bit. What would be your advice for any doctor or future doctor that who wants to get involved with MSF?
Um, so if this is something you want to do, it's first of all, it's a bit of a big commitment. You're just gonna go there for an extended weekend, so it's most of the time your first field assignment. It's something close to 6 months, if not a year. So most of the time people are not, you're like, oh my god, and there's like a recruitment process, and most of the time it takes 6 months to 12 months more or less, unless we are in a deep emergency and looking for people. So this is not something that you improvise, and this is something as well that needs to be sort of somehow prepared um, in terms of getting yourself, um, a sort of a citizen, a flexible, uh, uh, um, and 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 I would say easygoing citizen of the world, because you, if you go there, you need to go. You need to make sure that the first thing you need to make sure before going in any overseas assignment, being with Doctors Without Borders or any other organization, is to make sure that you're going because you want to go, not because you're fleeing a situation or because you want to escape something. But it's this is not a good plan if it's the case, because it's
Right.
going to backlash right away. So if you go, is make sure you have an exportable and I would say job and talent. Make sure that you are in a good headspace, that you don't have like psychological problem and you're not escaping or fleeing a situation. um, Make sure that as well you are financially sound enough that you can as well take that sort of a blow in your financial income.
Right. And to follow up on that question, what can students get? How can students get involved with MSF during their medical school if they wanted to?
Well, we I don't know if it still exists, but when I was the president of MSF Canada, we used to have a different sort of club per university. There was an MSF group at McGill. There was one in, I think, Laval, and so they were doing different activities, inviting people who were coming back from the field, and they were doing some sort of increased awareness about what is happening in different sort of crisis zone. And it's a nice way to get involved. I think it's a nice way to be able to interact with people who went to the field freshly from the field most of the time. So that's one thing. I think the other way is this there's so much way to get involved now in sort of global action somehow, through the net, by being part of different group that is I think that you have so many, I would say, opportunities that yeah, it just I think that you're not short of possibilities. You can do your elective overseas. You can be part of group like Amnesty here or like the MSF Club. You can decide to do some things at personal level if you want, and going in volunteering through different sort of program or on your own. So I think the opportunity that you have has nothing to do with what I had in the 80s.
And we were just wondering, we're in a fifth wave right now in Quebec, and in Canada. And how do you feel about the current restrictions that are in place, for example, right now in Quebec? And what do you predict? Is it is the curve will the curve go down? How do you feel that the management of this whole pandemic has been going?
I I don't think I'm going to go like in specifics, but I'm going to go in generic, because that this is I think it's so easy to be a critic on things when you're not in the leadership role. So, but what I can say is the fact that there's some basic assumption that we fail to somehow recognize and learn from it. And what I've learned through like more than 25 years of tackling epidemics and regional epidemics and pandemic is the fact that it's a humbling exercise. What can go wrong. The Murphy's Law always apply. It will always somehow, I would say, spot the weakest link of your healthcare system and just break it. Um, Magic thinking uh, doesn't work. It just it just it just most of the time is you need to prepare for the worst case scenario and hope for the best case scenario. What you've done instead here often is we've based our assumption on the best case scenario. We hope for the best, and then we close our eyes and waited. And I think that kind of posture does not allow you to anticipate, but it always make you in a very reactive mode. And I do hope, which I think there's very little chance with what's going on, but I do hope that after we've gone through how many ways we're going to need to go through with COVID-19, that we're going to have a time of reflection, and that we won't do what I call the double fault of not being prepared and not learning from my own mistake.
Mm-hmm. Yeah, no,
I
definitely.
I definitely agree with you, and I think the way to look at the pandemic is more of a realistic way of looking at it, not necessarily an optimistic way of looking at it, and be really realistic with the measures and the pandemic just in general. So
And
what
then
are
if I may add as well, as
yeah,
I think the COVID-19 pandemic is somehow a rehearsal of what we're going to need to face in terms of global threat, be it the climate change, and it
right,
really calls upon each citizen about how we're going to come together, because unless we align ourselves, we're going to fail. And then we, so far, of not having a passing rate with this pandemic. Countries didn't align to help each other. When you look at the vaccine and how rich country has been hoarding vaccines, and less than 10% of the population in low income country got at least one dose of vaccine, is is basically, I would say, a scandal. And so therefore, if we're not able to realize that we're all in the same boat, and whatever happened elsewhere, we're so much interdependent, interconnected, that it will come to us eventually. And I think we I'm fearing that it's going to be very challenging to tackle the climate changes challenges in front of us.
I agree with you 100%. And to follow up on what you're saying, and I think you answered a little bit the following question, which is what are your thoughts about the inequalities during the COVID-19 pandemic, such as the vaccine access? Do you think they're the same inequalities as access to care, or the disparity is greater during a pandemic?
Oh, I think that it's been enhanced because when you look, in low income country, when we just say no, like for example, telework. How can you do telework in LIC, and how what does it mean? Knowing that there's so many people who do those little work that is not accounted for, like selling, their vegetable from their garden, and getting some few extra money for that. It's just by not allowing in-person activities, it basically threw people in extreme poverty in low income country. And it's not true that we are equal in front of the disease. Is The reality is some are being much more impacted, and for a much longer phase than others.
I remember when the 2014 Ebola epidemic happened in West Africa. You did urge the international community and the UN to help out. And right now with the vaccines that are being, like you said, the vaccines are not being given to low income countries. And do you think that Canada and like other developed countries like learned the lesson, or well, clearly they haven't. But what do you think? First of all, why do you think that we're not, we're all double vaccinated and we've ordered so many vaccines for the third dose? Why do you think that we're not giving those vaccines to those countries? Because those countries, the healthcare workers are not even vaccinated, So why do you think we're not sharing even the technology and giving vaccines to those countries?
I wish I wish I will know why, but I think it's the basic human being. Is I think that human beings are survivors and they want to survive, and so therefore they're gonna put themselves first, and and I don't blame countries to pass domestic, I would say, interests before international interests. But in the type of relationship that we are between each other nowadays, it's just you cannot pretend that when something happened in the remote places will not eventually impact you. And as the old say of saying, when China is sneezing, North America is having a cold. So this is the kind of thing that we're going to need to come to terms with. And what I'm shocked by is this the vaccine hoarding is a scandal. It's a disgrace, and it's something that I find hardly understandable after a certain while. And then I came to terms, when Omicron came and people just say we're gonna go for a third dose, and I just said, well, this is it. We will not share our extra stockpiles. And then what I'm shocked by is the fact that here in Canada and many other countries, we are still not allowing what we call a TRIPS waiver, basically having a waiver on patent for vaccine or for diagnostic tests or for treatment for COVID-19. And this is why I say, okay, you don't want to share a vaccine, possibly understandable with what we're going through, but then why are you preventing to share the recipe of those new technology? And we know that nothing will happen overnight because there's probably a need for tech transfer and a need for know-how, knowledge, and all that. But the reality, if we had decided in spring 2020 that we were waiving the patent on those future discovery,
Mhm.
we probably, would be in a better place today. And it's untrue that we don't have potential places where they can manufacture. We have actually identified more than 100 hubs where they could possibly, become a future manufacturer. So for me, it's this sort of greediness over collective needs that has been enacted, and for which I think is a disgrace, and I think is going to be a moral stain on our collective history.
No, I definitely agree. I mean, there's absolutely no reason that our lives matter more than another life, right? Everybody should have the same equal chance to fight this pandemic the right way, and access to vaccines and healthcare and all the measures that we're lucky, we're blessed, we're Canadians here, we have access to all of that. But every country should have the same
So,
access.
as medical student, then you could sign the petition about asking our MPs to go and do the TRIPS waiver. You can ask them, to share technology. These are small things, but if our governments feel that there's a lot of pressure and citizen drive behind that, they might give in and stop sitting on the fence.
Definitely, yeah. We will definitely advertise that with our peers and our colleagues. It's very
Yes.
important. Um,
So, another question regarding the pandemic. What are the main challenges faced by developing countries in the fight against COVID-19, both on the ground and on the political landscape? How those challenges compare to those experienced in developed countries like ours?
Well, I think that I think there's I think the challenges have evolved over the length of this pandemic, and I think that right now, when you look at all things that happened in South Africa with Omicron, and the peak of cases, uh, but that was sort of short-lived, and and the number of cases that were high, but the number of death fairly low. Um, this is quite interesting, and of course they are in summer, they are like in summertime. But I think the challenges is when finally supply of vaccine will arrive in volume in low income country, and namely in the African continent. um, I wonder what kind of priority uh, national vaccine campaign will take. And I'm saying that with caution, and I don't want to be misquoted, but they have so many other challenges in some of those countries, and possibly it's not because that we're gonna dump millions of vaccine, and hopefully they will have a long shelf life to a country that people is going to queue to go and get it. There's going to need to be a fair amount of legwork. It's going to need to be a campaign of awareness about vaccination, training of staff, making sure we get the good cold chain, making sure that we're bringing the vaccine from the tarmac of our airports to people's arms. And I'm saying that particularly because I know the distribution is going to be an issue, and it's untrue, like here, that people will do 10 or 15 kilometers to go and get a vaccine when they have other competing priorities. And just to go and take a bush cab for 10K might represent several days of earning of wages. And so when kids are dying every day of malaria or of watery diarrhea, this is one priority amongst many others priorities.
Right.
So the challenges are big, and then we're gonna need to in a very empathic way understand the I would say the different priorities they are facing, and making sure that as we are possibly giving an hand or accompanying the delivery, the distribution of vaccine, that we don't do it in a neo-colonialistic way. And that is the danger, I think.
Mm-hmm. Yeah, no, definitely. And to also speak about something that you've always, advocated for during your career, the migrant crisis, which has been going on for a bit of time right now. One of the major issues is that has been going on in our decade is millions of people forced to leave their home due to either conflict, persecution, or even climate changes. And there are approximately, we estimate, 25.9 million refugees and 3.5 asylum seekers according to the UNHCR. So it's a big problem because there's been a lot of fear and a lot of government refusing to take on migrants. So what do you think medical students or current physicians could do to decrease and to decrease the fear that was created against migrants and refugees, and to advocate for them and for their health and for their human rights, basically?
I think that it's about perception, and it's about educating people about what is going on. I'm saying that because this is a topic that is somehow close to my heart, because I'm a product of migration. My parents came here in the late 50s, and I always said that I've been one of those lucky lucky people who didn't have the American dream but got the Canadian dream of going to the best school and being in a safe place. And the reality is what people fail to understand is there's nothing that's going to beat the motivation of a parents to give a future for their children. There will be no wall high enough to prevent them of doing the journey. There will be no sea dangerous enough to not let them do that. Is this is about survival again, and it is so humane. It's such a human instinct behavior. So nobody leaves their country just for fun. You leave the country because it's not bearable. When you're refugees, it's because it's not bearable. It's you don't have a future. And so we need to basically give, I would say, humanize people who are looking for future for their children or for themselves. And instead of characterizing them as future threat, we need to characterize them as basically human being looking for future and able to contribute to future. And I believe that many people of my generation have contributed to future. And I was lucky because I was in the time where we there was not such a perception issue back then in the 50s. But today, the best way to fight, I would say, this pushback on refugees is to humanize them.
Yeah. No, I completely agree.
To switch gears a little bit, the authors of the JAMA Network Open paper determined that female pediatricians are less likely to be first author of perspective style articles, meaning that they are less likely to have opportunities to express their opinion and provide insight that may influence the mind. So, have you ever experienced or seen differences towards women in the medical field?
I guess would be the short answer. Yeah. Like I was brought up in the 80s in med school. I started med school in mid 80s, and yeah, you didn't have the same treatment if you were a female versus a male. And I don't think you're going to be facing that because I think we have evolved a little bit more. And even if it happened, it would be spotted, and people will say this is not acceptable. Whereas in my time, we couldn't say that per se. We just has to suck it up. So I think that you're in a better place today.
Okay, I'm glad to hear that. Also, just to add on to the topic, how important is it to promote women in leadership positions? Um, Whether it's you working for an organization or being a physician in the hospital, how important is it that we put women in big leadership position?
Oh, I think it's absolutely important to get women in leadership position, and I think that we need as well to give the flexibility for women to be in leadership position, because nevertheless, even if we are in 2022, there's a lot of I would say still today responsibility, not everywhere, but I don't want to be caricaturizing characterizing things to a caricature level, but the fact is women bear children, and often they are the one who do take more of the responsibility around the children. And if we are not accommodating some of that to a certain extent, and if we're not accommodating that um, family life is important anyway in the balance of people, and you can still be a good leader even if you have some sort of you know um, how can I say boundaries
Mhm.
about your professional life and your personal life. Yeah, I think that it's something that we need to come to terms and move on with it. This for me should, I wish, my biggest hope is I will not get questioned about women in medicine anymore, because this would be something from the past.
Mhm. Yeah. Okay.
Hopefully, you're right. In the future, this topic should be a topic of the past because we would have had put in systems in place and went across those barriers that are currently still present a little bit.
Okay, so we have a segment on our podcast. It's called Rapid Question Segment. Basically, it's like a fun segment. So we ask you a question, and then you just give whatever. It's like a small question, a fun question. You just say whatever is on your mind, and then we just go to the next one. Okay, so the first question is, if you were not a doctor, what would you be doing?
Marine medicine.
Perfect. So, what is your favorite city and why?
New York City, um, because this is the city of that I dreamt to visit when I was young, since I'm 6 years old.
Okay, what's cool? Sorry, what is the one thing you miss about being on campus and as a student?
Well, I think it's a campus life. It's to be with people. That's what I miss.
Perfect. And what quality, what's the best quality to have as a doctor?
Empathy,
Okay, and then if you could cure one incurable illness, which illness would that be?
HIV,
Perfect. One specialty you could never have seen yourself do.
neurology.
Would you rather quarantine for another 5 years or start medical school all over again?
Not sure.
What is your favorite memory as a student?
Favorite. As a medical student,
Yeah,
Or yeah, as a
yeah,
medical
or
student or high
anything.
school
Yeah.
student, elementary school, any.
arguing.
Okay. What is your favorite restaurant in Montreal?
Ruby red dim sum.
Perfect. What's your favorite hobby?
Reading.
So, poutine or pizza?
Pizza.
Beach or skiing?
Skiing.
Soccer or hockey?
Hockey for sure.
Okay, okay. And then okay, thank you so much. And then any advice would this is we're gonna conclude with this. So any advice would you give to someone in medical school right now or somebody that's trying to pursue medical medicine that you wish you knew at the start of your career?
Huh. Um, I think I wish I was so driven when I started, and I wanted to go into medicine, and I flushed everything around. It was the thing I wanted to do. I had that sort of tunnel view, and I would just say the reality is when you have started in one path, especially the medical path, for some reason, you have very little chance to get exposed to something else afterwards. So before you get into medicine, um, do as many things as you can. Um, and even do like I regret on not doing an undergrad, but I was so driven. I wanted to go so much into medicine. But if I had to redo that again, I would go probably in history or do law or do politics. I do find that we often not. It's because I'm a pre-med. I'm not as well rounded and haven't been exposed to different type of knowledge. I had to cut up on this on social sciences and history and geography on my own. Um, but I think that it's those times of university undergrad especially are precious time where this is the only time as well that you're still not yet to I would say engage into a path, even like into your political commitment in terms of you're still open. Well, stay open as much as you can. But the reality is, if you want to achieve something at one point, you need to get really focused. But before
Right.
you get there, try to get as many input as you can. And I didn't do that.
Yeah,
That's some very good advice.
it really is.
I hope the listeners follow it. Is there anything that we did not address that you would like to add?
I think that especially your dental and medical student, it is really important to have fun. And and I feel privileged because I have fun most of the time. And even in the darkest time of my field assignment with MSF, we still had fun, and it's important. And you should keep that as I would say, as well as a goal. Because sometimes, without, how can I say, overlooking the tragedy or the seriousness of where you are, uh, you should still have this grain of 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 fun, of empathic fun.
Hmm. Yeah. No, that's really good because everything can get very stressful and overwhelming, and sometimes you forget and you get stressed and you don't think about the present moment until it's not the present moment anymore. So,
Well, it is that, and then I think the last thing I would say is because I learned it, and I wish someone would have told me, is to always say thank you. And especially when you're a dentist or a physician, you actually, your success is tailored to your team effort and your team people. And and I always finish my shift by thanking my staff, because if they weren't there, I would be so useless. Honestly, so useless. It's the same thing, when you go on a mission, and what would a doctor do in Afghanistan if we were not having logistician and nurses? We'd be desperate.
Right.
We'd be useless. So be aware that you're part of a bigger theme, and say thank you and be grateful.
hmm, yeah, no, I completely agree with you. All
Yeah.
right. Well, thank you so much, Dr. Liu, for joining us
Yes,
today.
thank you.
It's been an immense pleasure to having you, and we look forward to seeing where your career flourishes.